Hi there. How's it going?
Very good.
Good. Can I get a cherry pie?
Cherry pie, you got it.
I've always typically been in cities of about 500,000 or more. There's an intimacy about being in a smaller community where you run into people that you work with out in the community and you don't feel like you're an anonymous person. And the same is true about being in the hospital where you see the same people day to day. It's nice to have people say hi to you and ask you how you're doing and recognize you.
It's a beautiful Okanagan community. There's lots of outdoors activities that you can do here. People are friendly in general and open to newcomers to the community.
What do you think they'll do? I thought it was a really good opportunity for Vernon to have 2 medical students go through our hospital. That's a great retention and recruitment tool.
The ICC was an easier decision. I liked the model. And then the question was just, where is that going to happen? One of the things about Vernon that stood out was just the day was so organized. The site visit kind of blew everybody away. It was really exciting to see a brand new facility that you kind of be the first student to work in.
So now do you think that that's the whole reason for some of these integrated community clerkships is to bring learners into these smaller communities and give them exposure to smaller community medicine?
So then we looked for accelerations after that point.
Anytime you bring young people into an area, it revitalizes, keeps the energy high, brings fresh thinking, and of course brings in new ideas in medicine.
It is a new site. There's not as many students here. Therefore, we get a whole bunch of attention from our preceptors. We get to do things hands-on, things that in the 3rd year sometimes are listed as things to see, but we actually do that.
Hey, my name is Rafael, medical student.
The students come here and work through what we call mini rotations. So unlike the traditional clerkships where they may spend a full couple of months in an area such as internal medicine, the students would have that experience in smaller blocks spread over the course of the year. And during those times, they would also be connecting with their family physician.
Due date from last menstrual period, she was 38 weeks, and they say that
it allows them to have some continuity with their family practice preceptor, and it also helps to tie in their experience within specialties.
We're going to push down a new.
One of the great things about the program is you're expected to see patients throughout the course of their care from your first day in September and trying to follow them through to the end of the year. And I think when you see people go through that journey, you have a better sense of their needs at particular times and sort of longitudinal needs as well.
The way it's structured, the opportunity for learning, doing lots of hands-on, those are the main attractions of this program.
I think one of the great things about being out here is you're one-on-one with a staff physician. So whether that's a general practitioner or a specialist in the field, you're always working with somebody who's fully trained, been doing this for a number of years and has a lot of experience under their belt.
One of the advices we were given at the beginning of the program was to try to bribe the nurses as much as you can, because they will help you. They will let you survive this very demanding and challenging program.
There's a good energy about the program here. Site directors, they seemed excited to have students. There was a lot of buy-in from the physicians who would be involved in the program. We had specialists, family practice preceptors, and the same sense that there was a lot of energy and excitement about having students on site.
If we are not in the hospital, we tend to study, but in my spare time, I try to continue with my hobbies. One of my hobbies is martial arts. I do go out and train and try to keep in shape, which also helps with the studying, of course.
Balance is something that they emphasize quite a bit in the ICC. So Vernon is great for anybody who does outdoors kind of things. Wintertime, there's a ski hill 20-25 minutes away. I've run marathons before, so I've joined a running group here, and I'm also big into cycling, so I've made a few trips out to Kelowna, up to Predator Ridge, and done lots of cycling in the area. Summertime is great for farms and fresh produce and getting locally grown stuff.
It is tailored towards training family doctors for the future, especially in the community-based settings. Even for the future specialists, it's a great learning environment.
We have a very cohesive medical staff. We have excellent representation in all of the core specialties.
Our site is great. It's one-on-one. You don't have residents around. You get an opportunity to interact with staff physicians. It's a beautiful community, lots of activity to do, and look at our new facility. It's pretty great.